welcome to Unstress Health. My name is Dr. Ron Ehrlich. Well, dementia. Dementia, as we will learn today, takes many forms. In fact, apparently there are over 200 types of dementia, and of course most people associate Alzheimer's as dementia, and there are many other forms that it takes. And most disturbingly, as you will hear today, this is affecting people at an ever younger age. And like so many health conditions that perhaps your doctor may not have explored, the response that is often given to patients with the diagnosis is, well, there's nothing much we can do about it. There's some new medications coming on the market, etc., a familiar narrative no matter which disease you are talking about. But guess what? Dementia is preventable, it is treatable, and there are many, many things you can do about it, even if your doctor doesn't know about it. So today's guest is Jo Grabyn. Now, Jo is the founder of Bounce Matters, and she is one of Australia's leading clinicians in the prevention and reversal of cognitive decline. Now, since 2016, Jo has been applying Dr Dale Bredesen's pioneering work to help individuals or families stabilise and even reverse dementia symptoms once thought irreversible. And this is so interesting. Dale Bredesen is a world-famous neurologist who himself, after 20 years of practicing, had an epiphany through his functional medicine life. Look, I'm not going to spoil it. He had an epiphany which led to the Bredesen protocols, which have transformed literally tens of thousands of lives and may well transform yours here today. She's now training practitioners across Australia to do the same. And we're going to explore the science, the hope, and some practical steps for keeping our brains healthy for life, and why prevention truly starts decades before symptoms appear. I hope you enjoy this conversation I had with Jo Grabyn. Welcome to the show, Jo.
Hi, Ron. Thanks for having me.
Jo, dementia, neurodevelopmental issues, and dementia being a big one of them is a big problem. And before we dive into prevention and reversal, and a concept that a lot of people may not be even familiar with, can you paint a picture of where we're currently at with dementia as a public health issue, both globally and in Australia, and how significant is the challenge, and what trends are you seeing? Paint a picture for us.
So it's actually quite a scary picture, to be honest. Every 3.2 seconds somewhere in the world is actually diagnosed with dementia. In Australia, we're looking at dementia being the leading cause of death for Australian women and the second leading cause of death overall. So it's far surpassed cancer and cardiovascular disease and all of the things that we've sort of taught to be aware of and concerned about. And right now, there's, from a Western medicine perspective, it's just like, I'm very sorry, this is your diagnosis. I suggest you get your affairs in order. There's not very much we can do. And this is a trajectory, which is devastating for the patient, for their family. And it really puts them in a position of feeling incredibly hopeless and helpless. And when it used to, so my grandfather died of dementia when I was in year 7. He was 86. I don't really remember who he was as a man before he lost his personality. And, we always used to think of it was senile dementia. It was old people. But the terrifying thing is, like, I see patients in their 50s and their 60s. So the young onset dementia group in Australia, everywhere, but we know the numbers in Australia, is growing at a terrifying rate. And generally speaking, it's geriatricians who will diagnose dementia, but you can't get a referral to a geriatrician till you're 65, which doesn't help when you're 48. And most people don't go to see a geriatrician until they're in their 70s or 80s anyway, because to them, well, that's the last stop before I jump into a nursing home. So let's leave that one as long as we possibly can. And from a pharmaceutical perspective, there's over 60 failed drug trials. There are a couple of medications that are still quite widely recommended for people, being Aricept and memantine. There were 3 studied quite extensively last year. One has been conditionally approved in Australia. But they've actually got some quite terrifying side effects. So 31 to 34% of people from these medications can experience brain swelling and brain bleeding, which when you've already got brain damage, that's not very appealing. And even having spoken to a geriatrician about this, he's like, but Jo, even those meds really only work if we catch it very early. And people are they're too scared to go and see anyone very early because they don't want to lose their license. They don't want to lose their job. They don't want to be told that their life is over. So at the moment, the general model of dementia is a really pretty dark hole.
But Jo, obviously we're going to be talking about dementia, but what you've actually mentioned is not an uncommon response to a diagnosis of many kinds. And that is when a patient asks a doctor, why has this happened? Firstly, it is often dismissed as, oh, it's just bad luck, just your genes, whatever, rather than the doctor actually saying, we don't know, or I don't know, more specifically, I don't know. And then the second part of this, which again, we could be talking about dementia, we could be talking about cancer, we could talk about autoimmune, whatever. The patient says, what can I do about it? And because the practitioner's knowledge is so limited, rather than say, I really don't know, they would say, well, put your affairs in order. There's not much you can do. In other words, if I don't know about it as a doctor, it's probably not worth knowing about.
Yeah.
And that's not an uncommon response to chronic preventable diseases per se, let alone dementia.
Absolutely.
Yeah.
Absolutely. And for the programs that have been developed that are helping, there are many of the top neurologists and the top neurological centres that are poo-hooing it and saying that's ridiculous. It's snake oil. Don't use this. Don't use that. Nothing will help you. And yet the studies are showing that that's the absolutely wrong. The work that I've been doing since 2016, they've just wrapped up a very large trial. So we don't have the numbers on that yet because it was literally only finished on the 31st of October. And now they've done some basics around statistics, but it's not ready for sort of big discussion yet. But even when they were looking at publishing hundreds of people, they were getting an 84% success rate of either stabilizing or reversing cognitive decline. Now, the medications just slow down if you're lucky, and I do mean if you're lucky, the medications may slow down the decline, but they are not going to stabilize you and they are not going to reverse you. But if you're willing to do the work and you work with the practitioners that will basically go down every single potential rabbit hole for you and work out what all of your risk factors are and your contributing factors are, it's possible to stabilize it and turn it around.
Yeah. Look, I mean, you've been in this, as you've mentioned, you've been in this space for over 10 years. And you mentioned, I know we're going to be talking about the work of Dr. Dale Bredesen. What are the key principles behind the Bredesen approach? And what have you seen in your own clinical experience that brings, the whole thing to life, really?
Yeah, great. Great question. So Dale was a neurologist who spent 25 years looking for the magic bullet. And he's just like, it was just failed drug trial after drug trial. And again, and his wife was actually a functional medicine doctor. And he goes, for 20 years, she kept saying to me, Dale, this is so much more complex. This is going to be all of the metabolic issues that people have. This is going to be toxins. This is going to be gut issues. This is going to be the emotional side, environmental. And so eventually when he got sick of, getting nowhere with the medications, he decided to start digging in and seeing what all of these factors might be. So he calls it the roof with 36 holes. So he's kind of going, for every person, we want to look at which of their 36 holes has a hole in it, and which ones can we plug? Because we can't plug one or two, isn't going to stop the flow. But if we can turn around more than half, then we have a good chance of making a difference. So when I first met Dr. Bredesen in 2016, they had completed a pilot study of 10 patients. One of those patients has literally just walked from one coast to the other in the US, something like 4,000 miles, completely reversed in, the greatest, state of health cognitively and physically. what they did learn was that once you're on the program, you have to work the program and you have to stay on the program. You can't kind of go, oh, well, this is just 6 months later, I'm better, so I'm going to go back to doing all of the things that I did before, because it does come undone relatively quickly for most people. Basically because, we've actually been creating the damage for 20 or 30 years before we start to see signs. So I guess you could say the horse is bolted in a sense. And what we want to do is leash it and pull it back and get it under control. So it's sort of like trying to get in front of a moving train. But we can absolutely do that. And since then, I've seen patients who, like my youngest patient at the moment is 52, and it took her a year. She was diagnosed a week before her 52nd birthday. And it took a year of her and her husband and her daughter fighting, saying, this is not just menopause. Menopause doesn't stop me from knowing how to fold a blanket anymore. Yeah. It's, I think one of the, and that I actually saw them, they were here on Saturday, and even the neighbor who didn't know she had a diagnosis said, oh, have you been doing something different? Like you seem so much better now than you were a few months ago, and then I had one of my first patients who, he was the most astounding reversal I'd ever seen. He was a gentleman, he was 54, but his symptoms had started in his mid-40s. But he actually coached one of the New Zealand Olympic teams through 3 Olympics. And then he'd been a really high-end executive coach. And by the time I met him, he came in with his wife and his 2 adult daughters. He shuffled in with a pair of noise-cancelling headphones on and could only occasionally engage in the conversation. So most of my assessment of him was via his family. And we went hard with that case. We threw everything in the Bredesen protocol, plus photobiomodulation, plus hyperbaric, plus sauna. They were from New Zealand and they lived here for a couple of months. And within a month, his kids were going, oh my God, Jo, it's like we've got our dad back. Like he's sitting at the dinner table with our friends, like telling stupid dad jokes and taking the mickey out of everyone. And he sat here before he left and went home, and he's just like, Jo, thank you for giving me my life back.
Wow. I get a shiver down my spine as you tell that story. It is interesting though, isn't it? Because I kind of may have dismissed the genetic component too much. It tells you are susceptible. It tells you this is how this disease has manifested itself, which then says you're stuck, you are with your genes, so you can't just take a pill and get over it. This is part of what life looks like moving forward. But I'm guessing that one of the icing on the cake is that they would be feeling so much better in all sorts of other ways as well.
Absolutely. Like cardiovascularly, so fitness wise, they're able to exercise again. They get their personality back there, and, you calm their anxiety down. The reason he walked around with noise cancelling headphones is because his anxiety becomes so bad that he couldn't sit in a cafe or he couldn't go to a shopping centre. He was just so overstimulated and his brain couldn't manage the stimulation. And the thing is, yes, interestingly, Alzheimer's is fairly intrinsically linked with the ApoE4 gene, which I think is what you were talking about with the genetic link. Mm-hmm. But to give you an example, the 52-year-old lady that was sitting here with me on Saturday, she doesn't have an ApoE4 gene.
No.
So there are patients, we know that if you have 1 copy of the gene, then your risk is increased by about 30 to 40%. When I first trained 10 years ago, they said if you had 2 copies of the Alzheimer's gene, that you had a 90% chance. And last year there was discussion around calling that a diagnostic. However, that's been negated now, saying in essence, if you have 2 copies of that particular gene, your risk is around 50%. Yeah. But generally in the younger onset patients, so the people under 65, they often don't carry one of those genes.
But I would say, when I say genetically predisposed, I'm not talking just about one gene that we can put our hat on. I'm just saying your genetic makeup, you could have manifested as a heart attack at 52, or you might have got cancer at 52, but in your particular case, it's a cognitive decline. And before we go on, I think it is probably worth getting some definitions in place here between cognitive decline, dementia, Alzheimer's. these terms are all used interchangeably. Give us the 101, of dementia, Alzheimer, cognitive decline. How do we define them?
So if we think of, I think a good example is looking at irritable bowel syndrome, or IBS. IBS is like an umbrella term for a whole range of digestive symptoms that sort of they're like, oh, well, we can't quite figure out what it is, so we'll call it IBS. Dementia is an umbrella term for, there's over 200 different types of dementia. Alzheimer's is the most common form, so it's around 70 to 80% of cases. And cognitive decline ranges from, we have what we call subjective cognitive impairment. So it's like, you know that your brain isn't working the way that it used to, but you are not going to test up as though there's something wrong with you. So it's normally when the doctor's going, oh, don't be silly, you're just a bit stressed, or, you've just gone through a divorce, or you're not sleeping properly. But, in your heart of hearts that something's not quite the way it was. Generally, the next step from that, which can take up to 10 years, will be mild to moderate cognitive impairment. And you will actually, by this point, if you were to do a test with your doctor, there would come up as being, your cognition isn't normal anymore, but it may not be bad enough for it to be considered to be dementia. Alzheimer's itself requires an FDG PET scan or a spinal tap for them to be able to see that you have amyloid plaque and tau tangles. Though there is now, as of August, there's a blood test available in Australia called Brain Scan, done by a lab called Neurocode, and they look at 3 different markers. So you can actually do a blood test to find out up to 18 years in advance if you already have the markers for Alzheimer's in your bloodstream.
Mm-hmm.
So then there's a whole range of other types of dementia that are that are sort of in that Alzheimer's space or more severe. So you can have dementia that comes with Parkinson's, you can have Lewy body dementia, frontotemporal dementia, and then there's a whole raft of more, much lower percentages of people can have these other conditions. And then the one that we've heard a lot about over the last few years is CTE, which is the dementia that comes as a result of chronic concussions and brain injuries.
What does CTE stand for again?
You got me.
Put you on the spot. It's something to do with concussion and encephalitis.
Sorry.
Yeah. That's okay. But it's interesting. We've also done programs with Patrick Holford from Food from the Brain. I'm not sure whether you're familiar with the organisation, but they have a cognitive decline, the cognitive assessment, which combines a whole range of the cognitive function tests that you would normally do, plus lifestyle tests, and they assert it is entirely preventable. What do you think of that?
I think in many people, we know, like, even if we look at the Lancet papers, okay, even the Lancet are saying in 2024, they were saying 45% of cases worldwide are preventable through modifiable risk factors.
Right.
So
that's a start.
So, that went from 35% in 2017 to 40% in 2020 to 45% in 24. I wouldn't mind betting the next one comes out at 50.
Yeah.
I think
I'm guessing, Jo, as more doctors learn about these protocols, that number will go up. And there's a link between those two things, isn't there?
Yeah, absolutely. And there's so many things, even on the Lancet list. Like, I read through the paper in detail last year, and there were still things that fit into their, we're not quite sure yet type list. Things like sleep, for example. Like, we know that if people have creating oxygen debt every night while they're sleeping, if they have, a pulse oximetry under 98%, or definitely under 96, that their brain is going, is starved of oxygen when they're sleeping. So, it's crucial. So for some patients, just by getting them to put a CPAP on a nightly basis can have a massive change to their cognitive state.
So, Jo, are you saying to me that even in the Lancet paper, they are still unsure whether sleep has a factor, is it properly a factor? Wow. I mean, that is, you just don't get any more basic than that. You're talking about oxygenation, but one could also talk about the glymphatic system and the deeper levels of sleep. My goodness, if that's an indication of the EQ or HQ, health quotient of the Lancet, we are at a very rudimentary stage. Let's come back to the Bredesen approach. You've mentioned 36 holes, and I'm guessing we could cover, I don't know whether we will cover all 36 of them, but let's talk about those principles of what Dale Bredesen, reformed neurologist. Can I call him that? Can I call him a
absolutely.
Okay.
And I trained with quite a few neurologists that first training round that I did with Dale back in 2016. And what's interesting is the majority of the neurologists who were there were already, shall we say, reformed to functional medicine. So
often we've done a lot of programs on this reform process, and it's usually an epiphany which affects them in some way personally.
Yes.
Like they may go through their professional life telling their patients, look, there's not much you can do, it's just genetic. And then they or one of their family gets it, and all of a sudden they explore alternatives. So let's talk about those alternatives.
Yeah, definitely. And it's I find it very interesting because people are so astounded. So I'll give you an example: basic blood tests that we can get through Medicare, and how our pathology ranges differ to what the World Health Organization dictates as being baseline directives. Vitamin B12 and vitamin D are two of those that are crucial to be optimized in any sort of autoimmune condition, and particularly neurological condition. So there are markers that, Medicare could be happily testing, like as I said, B12, vitamin D, but homocysteine is a key marker. And to give you an example, the range on homocysteine in Australia is generally around 6 to 14, maybe as far as 18. However, in the Bredesen protocol, we want it optimized to 6 or 7. And the B12, for example, World Health want it that if your plasma level of B12 is under 400, they want an active B12 tested. However, the range for Australia for active B12 is generally around, it says above 35 or 40, but the research shows it needs to be above 100. So, and vitamin D is one that kills me every time because of the number of patients I see with osteoporosis. And the bottom of our range is 50, and the World Health Organization says anyone with a vitamin D under 75 is at risk of osteoporosis. So again, back to the 52-year-old I saw on Saturday, when I met her vitamin D was 38.
Wow. And
we got a bone mineral density done for this lady, and she has she's only 52, severe osteoporosis in her hip joints and severe osteopenia in her lumbar spine. And it's never been tested. It's never been looked at.
Wow.
Omega-3 is a crucial one, and we can't get that through Medicare, a proper omega-3 index. So it's what's the percentage of omega-3 across your body, but then also what's your omega-6 to omega-3 ratio? Because in really simplistic terms, omega-6 is more an inflammatory fat, and omega-3 is our anti-inflammatory fat. And honestly, I test this for every patient, and it's a private test that they have to pay for. And I think I can still, to this day, after 15 years of testing it, count on one hand the number of patients who have been optimized. The majority of my patients, even if they've been taking fish oils, so if you look at optimal omega-6 to omega-3 is a 2 or a 3 to 1, they probably average at 10 to 20 to 1. And even Ross Walker, I mean, I'm sure
even Ross Walker. Ross has been a regular guest on this podcast, but do go on. I love that. Even Ross Walker, go on.
Well, what I was going to say, like Ross he's my cardiologist, but he's also one of my mentors. And, he's like, Jo, I like the index, they say above 8%. He goes, I don't want any of my patients under 11 or 12% in their omega-3 index because it's so crucial for their cardiac health.
Yeah.
So we always want to get our patients to optimal health, not the way I look at it. And this is probably quite contentious, but I look at pathology lab ranges as if you're inside this range, you're not dead or you're not going to hospital.
And you will become a good customer eventually.
Yes.
And you will become a good customer. I think people misunderstand the public health system to a large degree. Yeah. Are we preparing healthy people or are we preparing good customers? There's a fundamental question that's easy to miss, but once you are aware of it, difficult to ignore. Go on.
Yeah.
See some of these ranges. And Ross, I love Ross's quote, who often says, people criticize some supplements as expensive urine, but I also like expensive blood as well.
Yeah.
I like Ross. Ross is a regular.
Yeah, he's a great
good
guy.
friend too.
So, that's sort of some real basics. Like, we're looking at kidney health. There's one of the things that like really frustrates me is on your basic biochemistry that everyone gets. It happens. It's one of the things that when a doctor does a workup for you, they'll do biochemistry with liver function. Yep. So your EGFR is your filtration rate of your kidneys. And I was always trained that number should never be under 90 until you're over 90. And the range in Australia is above 59. But if you get tested and you land at 58, you are automatically in stage 3 chronic kidney disease. Mm-hmm. And last year, I was at a pathology conference, and there was a functional medicine nephrologist who actually runs a big clinic in Thailand. And he said it's the thing he hates the most about nephrology is he's like, we should be looking at it when it's 89, and especially if the patient's 40, and going, we can do something about this now. But their theory is that they can't do anything about it until it's stage 3. And it's like, it's one of the things that I'm on with my patients all the time. I'm like, hey, like, you are half of 90. This measurement can't be here. Like, I am not okay with this. Yeah. So it's always about trying to help people optimize their health. So, because if we optimize our internal environment, then we're helping our brain work better, because we used to have this, I think, bit of a Pollyanna view that our brain was, it was protected, right? The blood-brain barrier means nothing that's running around in your body can get into your brain. It's fine. It's in its own little safe space. But it doesn't. It basically floats in the soup of whatever else is floating around in our bodies. So, with the Bredesen protocol, we're looking at, we're optimizing your bloods. We're looking at your gut. Gut microbiome has been sort of the buzzword now for at least 5 years. And, the gut-brain connection via the vagus nerve, but also with our bacteria, is crucial to understand. We're looking at things like toxins, and that's, I get frustrated by the quote from GPs, especially of, oh, you don't need to detox. Everybody's body detoxes anyway. And this is a big place where your genetics come into play, because there's certain detox genes that you either have them or you don't. It's not like, oh, you have a version of like the majority of our other genes. There's certain things that a lot of people don't even have it. And so, when you're looking at their toxic load, and people are like, oh, but, I don't smoke or I don't this, but it's like, well, if you're in one of the most, say the top 3 or 5 toxic professions, for example, then.
Like dentistry.
Yeah, absolutely.
Dentistry is one of the worst.
Dentistry. It terrifies me when I have a couple of retired dentists that are my patients, and and they're like, oh, but we still teach still use mercury at university. I'm like, don't even start. Don't even start. But like hairdressers and, airline stewards, because of atmospheric radiation. And then like I have a young onset patient he was diagnosed at 60, and it's quite the perfect storm. So he was a really active teenager, played rugby, boxer, went into the Navy, became a clearance diver. And as a clearance diver, he was a bomb tech. But his job meant he was exposed to, major explosions, which people don't realize how soft your brain is. So it's just doing their job has them getting a brain injury every time they blast something. Then when he left the Navy, he went into the police force, and he was under severe stress. He was in like a child abuse unit, and then he was bullied out of the police force because his stress got so bad that he had to leave. And then eventually he started his own business as a concreter. And it's just like, oh my God, your brain didn't have a chance. Like, it's so devastating. And he still has teenage children, so. And when he and his wife eventually got the diagnosis and they were with a geriatrician, he would ask a question and the geriatrician would answer his wife. It was like he wasn't even in the room. So there's so much that needs to change about the way that people are empowered or disempowered, spoken to and included. The toxins are a massive thing he's also got many brain injuries that need to be worked on. So that's something like part of my training was with Dr. Daniel Amen in the States, who does all the SPECT scans and the hyperbaric for the NFL players. He was actually the consulting physician on that movie Concussion that Will Smith did all those years ago.
Mm-hmm.
And, he taught me, he's like, you need to ask the question about head injuries in concussion often 10 different ways over a number of consultations. And, because it might take 3 or 4 visits for someone to go, oh, yeah, that happened when, like, I got pushed off the top bunk when I was 4 and landed on a concrete floor. It's astounding how much, when we're digging into people's history, decades and decades of history, that the little things sort of get lost. And it's very much about taking the time and making the effort to unpeel the onion to understand what all the toxins are, or just what all the different events are. How many surgeries have they had? Therefore, how many general anesthetics have they had? If they had amalgams removed, how were they removed? And then if they had a really difficult childhood, what did that look like, and what's been their assistance to recover from that type of thing?
It's interesting, isn't it, with trauma as an example, a lot of people don't realize that, well, muscle, not only do minds have memory, and it can be subconscious, but muscles have memory too, and that memory can go on for a lifetime. So things that you don't even think were significant, you talk about building one on top of the other, eventually you exceed an adaptive capacity, and bingo, you eventually have a diagnosis. But there's quite a process in between the building of those things and the actual diagnosis. And I'm guessing that's where your focus is so much on, is reducing that risk.
Yeah, absolutely. And even from a therapy point of view, like I often find, we know that when we're talking, we can only access that sort of 5% of our conscious mind, and the other 95% is in our unconscious and subconscious. So often, because I do a lot of mental health work as well, and we know that depression is an overall risk factor for both genders, but anxiety is, they're still trying to understand the idiosyncrasies of this, but anxiety is a big contributor for women, but less so for men. And often my patients are at the point of going, either I've had a counsellor for 20 years and it was a lot of nice conversations, but I didn't really get anywhere with that. And so normally I'm either referring my patients to a psychotherapist so they can look at the mind-body connection, or to a very good kinesiologist who can actually pull the answers out of their body without them even needing to know the answers. Because as you said, it's all stored in their energetic system and their muscles, and their body can't lie.
And another one is sleep too, isn't it? Because whenever you ask people about sleep, oh, don't worry, I can sleep anywhere, anytime. Sleep's not a problem, Ron, move on, And you go, well, hang on, that's not meant to happen. And people have this sense of normality. What is their experience in sleep is what else is there? Well, actually, quite a lot, as it turns out. Let's talk about sleep a little bit too, because I think that must be a huge risk factor.
Sleep is a massive risk factor. And so it can be as simple as asking someone, do you know if you nose breathe or mouth breathe? If they're here as a couple, I will actually ask the partner if they snore. Yeah. Generally, when someone's over 40, I will request a sleep study. And at the very least, like a pulse oximeter overnight to measure their oxygen overnight. A lot of my patients, if they don't struggle with anxiety, then I will encourage them to get something to measure their sleep, like an Oura ring. Because we don't just need to know the number of hours, we need to understand how much REM sleep are we getting, how much deep sleep are we getting. The glymphatic drainage system that you mentioned earlier, we need to be asleep for 6 hours before that really kicks in. So it's like our brain's own little, set of janitors that are going in there and cleaning out the toxins and helping us break down the amyloid plaques that get spoken about, and help us break down the tau tangles that are spoken about. And if we're not getting a minimum of an hour of REM and an hour of deep and 6 hours overall, but ideally we want to aim for more like 8 or 9, then our brain isn't being given the opportunity to clean itself up. Like our lymphatic system, every time we're walking around, up and down stairs, anytime that our muscles are moving, it gets an opportunity to push things out, but our brain is in a really different situation there. So sleep, once we're over 60, that was, so recently I did some extra modules with that were brought out through Recode, and they were all done by various dentists, but they were dentistry around sleep and toxins and the gut microbiome and things like that. And talking about upper airway resistance syndrome and the fact that once we're over 60, the risk for sleep apnea increases exponentially just because of generalized aging, and one of the things that I find really challenging is most people hate CPAP machines. Like they're really invasive. To be honest, I don't think I could sleep with one. And I have some patients, they live between here and Queensland, and I got a message off them today, and they actually got a CPAP for the wife, and 9 months on, she's still struggling. And so I've actually asked her to go and see Lewis or the team at Sydney Holistic Dentist when they get here, because I'm like, I need for you to get a sleep mouth guard and get it adjusted appropriately while you're here. Because I've got other patients who have done that, and they're like, oh my God, it changed my life. Like I couldn't use a CPAP. One of my patients, he's like sleeps between 3 different bedrooms. He has this thing that if he can't sleep in one room, he'll go and try another one. Maybe it's a temperature. But he's like, my mouth guard goes everywhere with me. So it makes it, you can travel with that. And but even from a younger perspective, like often bad sleep patterns can start happening as, at toddler age.
Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory Panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below, or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you.
Well, we've done programs with Dr. Jim Papadopoulos, respiratory pediatrician, who made the statement that 50% of ADHD diagnoses are undiagnosed sleep disordered breathing conditions. So people rush towards the medical intervention of prescribing Ritalin, but it actually could be a poor sleep that is causing that kind of problem. And similarly, it's so interesting to hear you talk about CPAP, because it is said to be the gold standard, if you like. And again, it is when it's used, it's great. The problem is compliance. People actually using it is a problem. And while the mouth guard, which holds the lower jaw forward and it's called a mandibular advancement splint, keeps the jaw slightly forward, it keeps the airway open. It may not be as effective as a CPAP, but at least you're wearing it, and at least it's improving things. So compliance is much better with those, and they need regular adjustment. That's another really important thing. People think, and in fact many dentists think, they only have to give their patient the appliance and off they go. They'll never see them again. But we would encourage people to bring it in every 6 or 12 months to review and adjust.
Well, as we age, as we eat different foods, as we potentially gain or lose weight, all of those things are going to have a massive effect. So, even from the perspective of thinking about our blood work, we change our diet, things change. We change our exercise, our markers might change. We go through a period of serious stress. Often when it's, people in their 40s and 50s, that serious stress, it may have to do with a parent who's become incredibly unwell or passed away. And so when we're looking at the various things to help people. We can't, even our prevention programs and our reversal programs, it's like even once we get you stable, we still need to check in with you every 3 to 6 months. And if something goes sideways, we need to know then, because we need to we go back in and dig into what's been going on in your life in the last few months, or have you guys moved house, or have you been traveling? I always think of an example that Dale spoke about of a lady that had complete reversal, and 3 months later, hadn't seen her for 3 months, and her husband rang and said, "Oh, I think we need to see you. Things are going backwards." And what had happened was that their son had actually gone to university, but he'd got a football scholarship. And so every weekend she was getting on a plane and flying to wherever her son was. Wow. So there was a lot of stress around that. There was the travel, there was the reduction in oxygen when she was traveling. And she just wasn't resilient enough yet to cope with that. So they're just the different things. That's probably one of the other things that we should talk about from one of the things that we really dig into, which seems weird, is people's homes. When it comes, especially when we've got cognitive issues in early patients, if you've got someone in their 40s and 50s, it's, are you living in mold? Is there any mold in your home? Oh, there's that little bit on the window sometimes that I have to wash up, and it's like, okay, so we have two options. We can either get you tested or we can get your house tested, but probably one is going to lead to the other anyway. Yeah. Because the mold issue, especially in particular areas in Sydney, you think about how much rain we've had over the last few years compared to what Sydney used to be like. And some of the older areas like the eastern suburbs and like Mossman, especially anywhere where there's lots of little valleys and crevices where houses don't get, they have parts of the houses that never dry out because they don't get sun because of all the lush landscape. But for the people living in them, that can become a massive problem. And it can be the thing that's driving their cognitive issues.
We've done programs on home biology, and I think the energy efficiency of our homes, where air vents are closed off to preserve heat, is a problem because we don't ventilate our rooms. But also the ubiquitous use of gyprock. If it ever gets water damage, you literally cannot remediate, or often can't remediate, that water damage that's occurred there. So it's a huge issue. I imagine radiation, as in the phones, the Wi-Fi. I mean, my God, that must be open a whole can of worms there.
It absolutely does. And so radiation, EMF, we think about Wi-Fi, we think about phones, we think about screens. I mean, I'm sitting here in front of 3 screens. All I can say is, thank God I actually have an EMF blocker on the back of my phone, which is sitting here protecting me from the little space that I have here right now. And especially now, because often people, more and more people live in apartment blocks for, convenience. And so even if people are like, oh, but next door neighbor's not going to turn off their Wi-Fi. I'm like, I don't really care about your next door neighbor. Let's just limit what we can for you, and, and turn yours off, and, use blue blocking glasses at night so we can try and get the light right, because we're so, as much as many people are malnourished, we're also malilluminated with look at you go. So
I've put on my blue blockers for those listening audio. Go on.
So the radiation is definitely an issue. Nicole Bilgemer, who actually owns the Australasian College of Environmental Studies, so she was my lecturer way back when, and then she built that college here in Australia, and she finished her PhD, I think either early this year or late last year, on the impact of the environment on chronic illness, and it's really pretty terrifying. And we look at, with my patients, I'm like, what have you got in your bedroom electronically? Like, if you have a TV, unplug it at the wall. Don't just turn it off with the remote. And, what's on the walls surrounding your bedroom? Like, are you next to the laundry, or are you by a fridge, or is the TV from the the 70-inch TV from the lounge room next door against your wall? And, so there's so many things that we really dig into the nitty-gritty detail over time to make sure that we're trying to optimize every part of someone's life. And exercise is a huge thing, and the interesting thing is, often what I find is that people who are like small and slight, who have never really been into exercise, like, oh, I didn't need to exercise because, I don't need to lose weight. I'm like, do you know that your brain actually needs the extra oxygen circulating that we get from exercise? And so, it doesn't matter how old you are, you can always start. I'm often starting a lot of women in their, postmenopausally. It's like, it's time to start weight training. And they're like, but I don't want to look like Arnold Schwarzenegger. I'm like,
yeah, that's probably not going to happen, but
like, I promise you never will. But we need to get you on board with some weight training, and, or we get you walking when you do walks, when you find a seat, you can do, squats, or you can do walking lunges on the way. And because I find this really quite cool is that leg strength correlates with cognition.
Oh, interesting.
So, if I can get people to do nothing else, I'm like, do lunges and squats, and walk up the stairs with your heels on the stairs so that you're actually activating your glutes. And, little things that you can have people do without saying, you don't have to go and get a personal trainer, and you don't need to be running an hour a day. When I first trained with Dr. Bredesen, it was very much a minimum of 60 minutes, at least 5 days a week at a moderate intensity. So sort of like a zone 3 in cardio, and, weight training once or twice a week would be nice. Now it's almost like the evidence is flipped on its head, that if you do nothing else, do 2 45-minute solid weight training sessions a week. Obviously an integration of the two would be fantastic. But, if we're working people up to things like that, what they do, sometimes I'm getting people to actually pull back from the amount of cardio they're doing because it's having too much of an effect. Like, it's having almost an aging effect, but it's actually creating an adrenaline issue around their stress hormones. It's like, it's a Goldilocks effort. We need enough, but we don't, there is such a thing as too much.
Yep. Tell me, people are coming into you with a whole gamut or the range of cognitive decline / dementia problems. Where do you start? Where do you get, how do you start? 36 holes in the roof, how do you decide which one you're going to focus on? Because it must be so easy to also overwhelm people.
So nobody gets to just book in with me, because I need them to understand that they need to be ready, because it's not like going to your GP and going, my brain doesn't work properly anymore, give me a pill. And you've got 7 seconds of diagnostic time in a 15-minute appointment. This is, you're going to come and sit down with your family, and we're going to have 2, maybe even 3 hours of digging through your life. Mm-hmm. So before we do that, I'm going to send you a number of questionnaires to complete and fill in over time. I would like you to, map out a full health and medical timeline for me as best you can, from, your beginning of time through to now. And you can put, as much detail as feels good for you in that. And we're looking at, so I'll ask them for, any past medical records, any blood tests. We ask for, what medications and supplements are you taking now? But have you ever taken anything for a long time that maybe didn't work well for you, or that made you feel bad? And so we know then, because there's also a group of drugs that actually have an effect on your brain. And so just because they're not on them now doesn't mean that they weren't. Like, sometimes people have been on something like Nexium or an anti-reflux drug for 10 years, and they're not anymore, but they were. So it's things that I need to take into consideration for the bigger picture. And can you write me a food diary for 3 or 4 days, and then please include a weekend, because most people eat differently on the weekend. And so that way, especially if they are an older patient and they're going to come with a partner or an adult child or both, I'll say, like, do this in bite-sized chunks, 10 to 15-minute chunks. You're probably going to need an hour all up, but do it over time, because it is like peeling an onion, in the fact that the memories are going to come back. Oh yeah, I had that operation, and oh yeah, there was that accident. And, so that gives them some time to start to look at their life in a way that they probably never have. And then I have often say my brain doesn't work like other people's. I handwrite all my notes, and I have quite a structured, like, 4-page form that I work through for people, because it helps me remember, like, the many things that I actually need to ask them about. Yeah. And then when we get to the end, and I'm not I'm quite generous with my time, because I think it's important for them to be able to ask me questions that they haven't been able to ask other healthcare professionals, around things that are going on for them and how they can manage certain situations in the home. And they need to feel like someone's 100% on their team, which is not something most people are used to. And so generally by the time I get to that, they're having a brain explosion by the time I get to the end.
Yep.
So I'm like, okay, so off the back of today, we're going to do it.
But Jo, that must be an incredible learning experience for them to confront, perhaps for the first time in their life, that a lot of stuff matters and a lot of stuff is interconnected.
Yes. Often they walk out of those sessions going, I feel like I know myself better today than I ever have for my whole life.
Yeah.
And now I'm starting to understand how the things that I did along the way have helped me get to here now.
Yeah.
And sometimes there's shame and there's blame, and I'm like, there's no place for that. Like, it's, we've all had a life, right? And we've all been young, dumb and stupid and done things that we kind of look back and go, oh wow, I really wish that didn't happen, and I'd rather not have a conversation. But also everyone knows this is a completely judgment-free space, so it's the most I might do is take the mickey out of them, especially if they tell me that they ate Macca's yesterday. And it's like, okay, so that will be the last time that you ever go through the evil M. But it is still about trying to not, I will never try and pick on them and make them feel bad. It's just like, these things have to change, because these are the things that are stopping your brain from being able to work properly.
Yeah. I mean, we one of the things that I've learnt in my career over 40 plus years, and a mentor of mine, Dr. Janet Travell, taught me this 30 plus years ago, that if you take your time and listen to your patients and ask them the right questions and know what those answers mean, they'll often not only tell you what's wrong with them, but they'll sometimes even tell you how to fix it if you're in tune with what you're asking.
Yeah.
And I think that 2 or 3 hour appointment, when you consider that 1 in 6 Australians is on antidepressants, and 95% of antidepressants are prescribed by GPs, and most GPs appointments are 5 to 10, maybe 15 minutes. Wow. That's not a life-altering experience, but it's certainly, I can imagine those 2 or 3 hours with you going through their lives and connecting it is really an amazing experience.
I think it means a lot to them, but it also helps them understand that I'm going to be asking them to change a lot.
Yeah.
And I'm going to be asking them to do things that they haven't done before. And that without doing it, there's a causative relationship, and so often I do get to the pointy end. There's a health food store in Manly that they used to refer patients to me, but they would say to people before they came to me, just note, Jo's very direct. And I'm like, yeah, I'm direct, but I'm not, it's in service of you. Like, I'm never going to be nasty to you. I'm never going to be harsh, but I'm going to tell you the facts, and I'm going to encourage you to adult. And some people really hate that. When I've had, I had a lady here with her daughter, and was diagnosed with dementia 2 years ago, but they're all in denial. And we won't even talk about her diet, but she drinks 2 glasses of wine every night, 7 days a week, day in, day out. And when I said, I'm sorry, but you won't be able to do that anymore, she started crying.
Yeah, I'm not surprised to hear that.
Yeah. And I just said, I need you to understand that there is no safe level of alcohol for your brain. And, this is not the start of the journey. Like, it's already been going on for some time. So I'm going to give you the information, which is, it's not safe for you to drink alcohol anymore. How you choose to pull that back is your choice. It is something, I'm sorry, but I need to put that on you, because I know that we won't get the results we need if you continue to drink alcohol. And it's a really hard conversation. I have to have it a lot.
Yeah. I mean, I think most people, anybody that's gone alcohol free for a week or month or more would be aware of how ubiquitous alcohol is in everyday life. You've had a hard day, have a drink. You've had a great day, have a drink. It's a funeral, it's a celebration, have a drink, have a drink, have a drink. And yet this toxic thing, I think in general, it's the first week that is the most difficult. And once you're over that, you get to see, wow, this is actually how good I can feel. Interesting.
Yeah.
Interesting. Yeah. Yeah,
So
interesting. You keep going. This must be, well, life-altering. I mean, what the Bredesen protocol, which clearly addresses many different areas. You mentioned one thing before I ask you that question. I was going to ask you, how successful is the protocol? What do the statistics tell us? But before we get onto that, you mentioned biophotomodulation, which we used to call low-energy laser or red light therapy, and hyperbaric chambers and saunas. Tell us a little bit about those interventions and why they might be beneficial.
Yeah, so photobiomodulation is red light therapy. It's just at a very specific wavelength. So since 2017, I've worked with a company from Canada called Violight, and they've probably published the most papers on using the 880 nanometer wavelength which is what's called the gamma wavelength, which helps with cognition. And then they also use the alpha wavelength, which I think is 660, and they use that more for calming the brain. So generally, like when I first started working with them, they'd had one global study, which was on Parkinson's, and the improvement in Parkinson's patients was nothing short of astounding. Then they built out a global Alzheimer's study, of which there were locations here in Sydney, but then COVID happened. So they went from patients going into a clinic 3 times a week to giving people the unit to it's 20 minutes 6 times a week. So people were then able to use it at home, and their results were just so much faster. Their research ecosystem is enormous. They've done PTSD studies. They work a lot with the military in the US, a lot of traumatic brain injury studies, like different mental health studies. But from a cognitive benefit, like we've even seen patients that are in nursing homes. So nursing homes means you can't change their food. A lot of them are wheelchair bound. You can't give them supplements because you're not allowed to do it. And even within 4 to 6 weeks of patients using the headset for 20 minutes a day, they start to have improvements for them. So it's not like you're saying that you're bringing them back to normal, but for someone to be able to tell a nurse that they need to go to the bathroom rather than have an accident is huge, or to be able to remember that their loved one came to visit them that day, is massive.
And with this biophotomodulation, this red light therapy, is it in the form of a lamp? Is it in the form of a panel? Is it in the form of glasses? How's it delivered?
It's a headset. I can run and get one if you want me to.
Oh, well, we might do that at the end.
Today.
Not today.
But it's actually set up so that the lights are they're actually matching what's called the default default mode network of the brain. And basically the red light is activating the mitochondria. So the mitochondria are the little energy centers in our brain, and our brain cells, because they're so busy, have the most mitochondria per cell of cells anywhere else in our body. And so the mitochondria actually are fed by the red light. So it's one of the reasons why, like people with chronic fatigue, we try to encourage them to go and watch a sunrise or to see a sunset so that they can get red light activation through their eyeballs and into their brain. And, it pulses at a specific wavelength and actually helps. Like some people will say they can feel it, others less so. But like, I think in the, 8 years of having worked with the company, and they actually have this, what I think is a very impressive money back guarantee. So 6 months, 80% money back guarantee, no questions asked.
Wow.
So really it's like a cheap rental because it's quite an expensive piece of equipment to buy, but then it's like, well, you've got it, comes in a great little carry case. I've got patients that travel all around the world and take it with them all the time.
Wow. This is Violight. This is the Violight group.
Yeah.
Violight. And light is spelled L-I-G-H-T or?
Yeah, so B-I-E-L-I-G-H-T.
Yep. Cool. Okay.
And then hyperbaric, I've had hyperbaric oxygen chambers now for 9 years.
And remind our listener what that is.
So it's a chamber where you sleep in, lie in, read a book, and you basically breathe an increased amount of oxygen under pressure. So they range from mild hyperbaric, which is much like lower pressure, but it can just be pressurized air. So because there's more air jammed in the chamber, you get more oxygen, right through to the heavy duty chambers that you would get like at the Penguin Navy base that they use for the divers if they come in with the bends. So, there's a huge range. And the thing is, people just think more pressure, more oxygen means better. But actually, one of my teachers who is part of the International Board of Undersea Medicine, he did his PhD last year, and they actually did comparative studies of mild air-only chambers through to 2.4 100% oxygen chambers. And he said it's not that more is better, they're just different. So they actually looked at the genes that they turn on and off. They looked at the inflammatory markers that they turn on and off. They're still trawling through the data, to be honest. But what was interesting was when the Mayo Clinic contacted him mid-year about they were putting together sort of the top 50 anti-aging technologies. In the end, with the data, mild hyperbaric and then high pressure hyperbaric came out at, I think, numbers 3 and 4.
Wow. Okay.
So it's one of those things that when we actually breathe oxygen under pressure through pleural effusion, our plasma can pick up the oxygen. So when we're just breathing air out here, only our red blood cells can pick it up. But our plasma is 80% of our blood volume, and it can get to places that, like in the big scheme of things, red blood cells are really big when they're traveling around in tiny little blood vessels. And so often plasma can get to places that red blood cells can't. So, I mean, even from a brain perspective, when you think about how much of our brain is actually made up of fat, it's not a highly vascular area.
And this is presumably why hyperbaric chambers are really useful for injuries, because they just promote that kind of repair. What about saunas and ice, cold immersion?
So cold immersion is a hormetic effect, and you don't actually have to do an ice bath to get that cold. Like you can go from a sauna to a cold shower, or you can even at the end of a cold shower turn off the hot water and just dance around in it for 30 seconds. Sauna is very much about detoxification. And so if we look at the difference between, I refer to them, so everyone knows what an infrared sauna is now because there's a million infrared sauna centers around. But a lot of gyms still have like an old school, what I would refer to as a wet sauna.
Yep.
So the difference is a wet sauna makes you sweat, but you're only going to get rid of the toxins that are more or less sitting in the pores of your skin. An infrared sauna, because it has the infrared wavelengths of light through far, mid, and near, they won't have a lot of near. They can actually penetrate your body by 6 to 8 centimeters, and therefore all of your cells are then able to start detoxing the toxins out into your bloodstream or into your lymphatic system. So what we always recommend for our patients is, because we're two blocks from the beach, is don't immediately jump out of the sauna into a cold shower. Go for a walk down the beach and then jump into the ocean. Like, don't get wet until you stop sweating, because if you'll either blunt the response and you won't get as much in the way of the toxins out, or what will happen is sometimes people do that and then they come out of the cold shower or whatever and they start sweating again. And then the toxins are sitting on their skin and will reabsorb through their skin.
Mm-hmm.
So
interesting.
It depends on if we're looking at environmental toxins, mold, metals, as to what type of protocol it will put into place. But I've had a number of patients, including that gentleman from New Zealand that I mentioned, and we did literally 6 days a week of an hour and a half of hyperbaric and then a sauna every day. And within 2 to 3 weeks, they're different people.
And how long are we in the sauna for? Do you recommend?
Maximum 40 minutes.
Maximum 40 minutes.
Yeah, and an infrared sauna doesn't need to be as hot as a wet sauna.
Yeah.
It's actually about penetration. Like I get some people who can't sweat.
In fact, how quickly you do sweat is an interesting indicator as well as your detox pathways. Do you think? Is that true? What do you think of that statement?
It's one of those things. Sometimes I think it's an overall health parameter, because when I think about the patients that don't sweat, if they've been in there long enough and at a high enough temperature, they're often patients that have had chronic illness for a long time. chronic fatigue, chronic pain, not necessarily brain issues, but they've got different things going on that aren't that mean that their body's been under strain for a really long time.
You mentioned, and this is where I wanted to ask you, because we've said, a lot of people get a diagnosis of dementia and put your affairs in order. There's nothing much we can do. There's some new drugs coming out. We might give that a shot. Tell us what the success rate is of the Bredesen approach.
So at this stage, the last study that was fully published, that's, like I said, the Avanthia trial at this stage is too new for us to have the data on that, but 84% of patients stabilised or reversed.
Wow. I mean, that is quite extraordinary. Hardly surprising to any regular listener of this podcast, because this will go, I thought something like that. But that is an extraordinary statistic.
Yeah, and the thing is that one of the things that we do have to help people understand is so Bredesen's very careful in the fact that he says, expect it to take 6 months to start to see results, right? Yeah. But that's not 6 months from the day that you walk in my door down there. That's 6 months from the day that we've got all the ducks lined up. So that we have your diet altered and improved, and that we have you on the right supplementation regime, which means that we have to have had all our test results back. That we get to get all of the bits lined up, and then we count the 6 months from there. And don't get me wrong, Ron, I had a gentleman last year who has 2 copies of the Alzheimer's gene. He, it's the cutest story. He and his wife have known each other since they were 9. They're now like in their mid-80s.
Oh, how wonderful.
And interesting, because he has the 2 copies of the Alzheimer's gene, which is a cholesterol transport gene, but his cholesterol had never made it to 4. So his cholesterol's always been very low. And he'd only just started to get symptoms the year before. But he'd been in hospital, a lot of things had gone sideways. And at that point, his mini mental state exam, which is what the doctors were using for measuring his cognition, he was down to 22 out of 30, which is a clear dementia diagnosis. Now, they're pensioners, so they didn't have a lot of money to spend. But his wife is a rock star in the kitchen. And so she completely overhauled his diet. She went for a walk every morning. He'd go for a stroll. She got him out there for a power walk, doing his lunges, doing his squats. He's like, Jo, I was sweating. It just seems a bit unfair, but it's okay. She looks after me, so I'll chase her. Just a small handful of supplements to optimize his blood work, just his basic blood work that we'd done through the doctor, and a few things to help with his gut. And we managed to get him to implement some brain training because he was an English teacher. So a fact he was very proud of. So I'm like, okay, so literature and books. So I'm like, why don't you and Jenny have a little book club each day? So you'll read something and if you don't want to be on the computer, because he did eventually agree to go online and do online brain training. Within 8 weeks of working with him, his mini mental state exam came up to 27 out of 30.
Wow. I love this story. I love this whole story, in fact, Jo, and I had a feeling I would, because this is all about our mission on this podcast is about personal empowerment, and there is just so much people can do. Listen, I just want to finish with one thing. If you could communicate one message to people in their 30s and 40s about protecting their brain health, what would it be?
Start looking at it now. So Dr. Bredesen calls it a cognoscopy, which is funny because I often get emails for a discovery call going, Jo, can I have a cognoscopy? It's basically what we do is a full assessment, the same way as we would for a patient that already has symptoms. Dig out all of the risk factors, look at all of your blood work, look at all of the things that are basically going to be putting your brain at risk, and turn it around now and teach, learn how to eat for your brain, learn how to, how much exercise do you need? So with patients that we're doing prevention, I'm not quite the Nazi that I am with patients that I'm trying to reverse. But what I want to make sure is that people are empowered with all of the things that are their risk factors, and then all of the things that they can do to help optimize their overall health and their brain health. And then, if something goes sideways, I'm always here. But for now, these are the things that we can do. I guess with prevention patients, we're looking at the rocks rather than the pebbles. So what's a handful of big things that you can do now to protect your brain, particularly if you have a family member who has or has had dementia, and that, we do know that there are genetic links. There's also what we would refer to as familial links rather than just genetic links. And so rather than having that fear in the back of your head that, oh my God, what if this happens to me and I don't want to know, is get yourself empowered with the information that is going to allow you to have a really long, healthy, physically, mentally, and cognitively healthy life.
Well, Jo, that is a great note for us to finish on. And I just wanted to thank you not only for all the wonderful, wonderful work you are doing, but for sharing your knowledge and wisdom with us here today. Thank you so much.
Absolute pleasure. Thank you for having me.
Well, we could be talking about diabetes, we could be talking about cancer, we could be talking about heart disease, but in this particular case, we're talking about cognitive decline and in general, and dementia in particular. And lo and behold, yes, there are things you can do, which is actually the mission of this podcast, to empower you. With knowledge comes power. And just because your doctor doesn't have that knowledge doesn't mean you don't. And things can be done. And it's so interesting to see how often medical practitioners have an epiphany at some point in their professional career and then start to explore root cause, and lo and behold, many wonderful things develop from it. So when I was talking about, it's interesting also to consider the fact that you are genetically predisposed, and it's again an example of looking for the one gene. Well, of course, there are many genes, and when I talk about you being genetically predisposed, I'm not looking for one gene. I think we do need to have a healthy respect for family history, and that tells you are predisposed to something. But that does not mean you are predetermined to have that, or there's nothing you can do about it. That's what this protocol is all about. That's actually what this program is all about. We will have links to Jo's Bounce Matters website, and you can explore there what Dale Bredesen's protocols are. I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well.
Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness. From self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.